Participants at a health dialogue in Koforidua, the Eastern Regional Capital, are asking the government to increase its annual budget allocation to the health sector. They also want the government to address the infrastructure and personnel deficit.
In Ghana in recent years have been likened to graveyards by a section of the public, partly due to the bad treatment meted out to them at some health posts. The nonchalance by some health workers towards cases also stem from their apparent familiarity with death. The health sector in general is characterized by poor infrastructure, which undermine its capacity to respond to emergencies. Reports indicate that OPD attendance is on the decline in urban public health sector, but on the increase in the private health sector across the country. This can be interpreted as a decline in public confidence in the health service delivery in the country. As financial support from foreign partners dwindles, there is the need to raise funds from alternative sources to salvage the situation. Not only that, but to improve equal access to quality healthcare delivery across the country. It is against this background that Star Ghana is engaging stakeholders to spark public discourse on healthcare. The Eastern Regional Dialogue involved the media, civil society organizations and educational institutions. Sharing his experience at a hospital, the acting CEO of the YMCA, Mr. Daniel Ofosu, said he lost a friend to a particular sickness which doctors at the facility in question could not tell him. He said they kept asking for laboratory tests to be done on the patient without even checking on the results of the tests. With hindsight experience, he sought treatment for his own medical condition overseas, which went well. A lecturer at the Center for Social Policy Studies at the University of Ghana, Dr. Antoinette Chibo-Daku, said the health sector has many beautiful policies, but policies implemented are not effectively evaluated before jumping to others. She proposed that health service administrators are made to manage health facilities so that doctors who have turned into administrators can have adequate time to attend to patients.
We should start allowing administrators to manage hospitals and stop leaving doctors and nurses to manage hospitals. You need an HR manager. You need people who have been trained as customer relations people to deal with, a patient is a what? It's a customer. So a doctor is trained, a nurse is trained, but customer relations is not their priority. When are we going to allow administrators, HR people to manage our hospitals and take the doctors and nurses from administrative positions and allow them to deliver the healthcare service which they have trained to do?
The Afram Plains North District Director of Health, Mr. Robert Kwekubio, was of the view that challenges such as inadequate doctors, unavailable equipment and shortage in support staff, among others, should be tackled. The medical director of the Eastern Regional Hospital, Dr. Kwame Enimbuama, urged government to look at ways of funding the National Health Insurance Scheme to make it sustainable. The dialogue was organized by Star Ghana Foundation with support from African Rights Initiative International, Civil Society Platform on SDGs, Doctors in the Gap and the Graphic Communications Group.